taking time out of your busy schedule to join this webinar. So this webinar is being convened by Lifestyle Champions, and we'll be talking on the emotional and mental wellness, how to access care following sexual assault. And just before we begin, I would like to tell us a little bit about the nonprofit organization. So Lifestyle Champions International is a non-governmental, non-for-profit organization, and we aim to promote wellness by educating and lifestyle choices among the Nigerian populace. So we have three main goals. And the first one is to promote wellness by educating and encouraging healthy lifestyle choice among the general population. We also support and empower women to rise above domestic violence. And we help women access preventive healthcare services against non-communicable lifestyle diseases. So my name is Yemi Ayoguno, and I'll be moderating this webinar. So before we go into the main discussion, we have three main panelists, and Dr. Makinde would be here to support. She's the founder and the CEO of Lifestyle Champions. And I'll be starting the introductions with Dr. Abdul Malik, who also happens to be my teacher. So I once a teacher, always a teacher. So he lectures with the Department of Psychiatry, College of Medicine, University of Ibadan, and is an honorary consultant to the University College of Spain, Ibadan. Also, is the founder and the CEO of Acetal Foundation, a not-for-profit mental health advocacy organization, and they are committed to promoting better understanding around mental health issues in Nigeria. He writes for Nigerian Tribune, and he has experience from he has educational experience in child and adolescent psychiatry, mental health policy, and health management and planning. He's also an alumnus of the Lagos Business School, so he has experience across board. So thank you, Dr. Abdul Malik, for joining us this evening. We are happy to have you. Also, I'll be introducing Mrs. Bridget Taremo-Timi. She is a certified sexual and gender-based violence instructor. She's also a seasoned human resources practitioner, as well as a minister of the gospel. She'll be bringing in the community health perspective because she works with people. We have a panel of health professionals, but our main objective is to bring in people who actually have linkages with the community that we serve so that we can have more practical experiences on board. Thank you, Mrs. Taremo-Timi, for joining us. Also, we have here today Dr. Shodipo Oluwajimi. He is an alumnus of the ABU, Zaria, and also a consultant family physician. He is a fellow of the West African College of Physicians, and his clinical and research interests are in chronic medical conditions like diabetes, hypertension, and obesity. He also works with survivors of sexual assault and is currently the HOD at the Family Medicine Department of the Lagos State University Teaching Hospital, Ikeja. Thank you, sir, for joining us. So now we'll go into the meat of the matter. It appears there's been an increasing trend of sexual violence, and almost every time when you log into the news, there's always something going on about sexual violence, different ages. So this question will be for Dr. Shodipo. You work as a consultant to a center that provides care to many victims of sexual assault. So, sir, based on your experience, do you mind explaining what sexual assault is, the people who are most affected, and what the trend has been in recent times, especially in terms of age and incidence? So this is for Dr. Shodipo. Okay, so while we are waiting for Dr. Shodipo to come on.
Yes, good evening. Sorry, I didn't know I was still muted. Good evening. Can you hear me, please? Hello?
Yes, we can. Yes, we can hear you now.
Oh, okay. Sorry. Yeah, sorry. So, good evening, and thank you for the opportunity to be speaking this evening. I want to extend my greetings to all the distinguished panelists, and also to my very good colleague and someone who is doing a lot of work, Dr. Makinde. And this topic, we're just discussing the other day that it became quite apt with the recent events that have taken place. So I don't know, can I go on, please?
Yes, sir, please go on. If you have slides to share, please feel free to share.
Yes, so I'm just going to share my slides. What I'm going to be focusing on quickly, maybe in the next few minutes, is to talk about maybe some introduction into sexual assault and really focus on some of the work we have done at the Sexual Assault Referral Center in Lagos, which is the Mirabel Center. Try and share some of the data that we have from there alongside comparing that to another sexual assault referral center, which is in Sokoto, and just maybe set the tone before some of our other panelists can give us some of their insight into this topic. So, okay, let me go to my first slide. So I'll just quickly, I don't know how many minutes I have for this so that I can time myself. How many minutes do I have, please? 10 minutes?
Yes, I think 10 minutes should be good.
All right, thank you. So I'll just run along, and if I'm behind, if I'm taking time because I like to speak, so please, you could just give me a prompt so that I'll correct myself. Thank you. So we know that sexual violence is increasing all over the world, yet it's underreported, and it cuts across all ages, gender, countries, religious affiliations. But one of the challenges we're having is that there's really a fear by the survivors, driven by ignorance, poverty, and as we'll see, a lot of the age of the survivors is a problem, and the judicial system has actually not been able to meet up to some of the challenges that have come up. Many are not aware of the medical legal implications of sexual violence. Even as healthcare practitioners, we take some of these things as just another diagnosis, and we don't look at some of the long-term side effects that could occur in a person that has suffered sexual violence, irrespective of the age. But we must also not forget that sexual violence is not always about sexual satisfaction of the perpetrator. I think that's one thing that I've learned through my work, seeing survivors of sexual assault. You would see that there are so many reasons why people carry out assault, including blackmail, punishment, curiosity. Some people do it for money. We've seen a lot of people videoing people and using it to blackmail them subsequently for money. And power, this can all be motives. What we like to do at the Sexual Assault Referral Center, which is Mirabel, is refer to these persons that have suffered violence as survivors or clients. We don't like using the word victims because we feel that doesn't allow them to achieve healing. I'm just going to run through this because of time, but we must know that sexual violence as a whole, it's an all-encompassing term that goes beyond just a sexual act. It also involves attempts to obtain a sexual act, unwanted sexual comments, even acts to traffic people, and using sex as a tool of dominion over another person. For example, we've seen so many cases of lecturers and students. We've seen so many cases of workplace issues where people use that as a tool to get what they want from another person. And it can include somebody putting a sexual organ or a coerced contact between a genital part and any other part of the body. I think one thing that has kept on recurring, during my own work with sexual assault survivors, is the issue of the age of consent. We've had so many cases where people come and say, oh, this person is my boyfriend or my girlfriend. And we need to just remind them that Well, as for those of us in Lagos and other states that are practicing with the Child Rights Act, the age of consent for sexual activity is 18. And this is going to be very important because, recently there was the issue of the videotape and the age of the people, and so many issues came up, and everybody giving their opinion. But we just need to know that once somebody is below the age of 18, the person cannot give consent. So it's important that, especially for those of us that are in states where this has been implemented, we are aware of this, and it helps guide some of our comments and the way we handle sexual assault survivors. Some of the laws that guide this include the Violence Against the Persons Law. We have that of 2014, subsequently 2015, and some states, about 20 states, have passed this law in its original or modified form. So for example, in Lagos, they passed that, and they've even gone a lot more than that. So that guides a lot of what we do. Of course, we also have the Child Rights Act law of 2015, and there have been 2000, but there have been many subsequent reviews that have taken place. And this is also important because if we could go online to download this very important law, it would guide, some of the way people interact with children and know what can and cannot be done. So the issue of the burden of sexual violence in Nigeria is still something that a lot of work needs to be done. We really have no national database. And I make bold to say that up until 2013, when we had the first sexual assault referral center, which was set up in Lasut, that is, it's known as the Mirabel Center. That was when we started having the concept of sexual assault referral centers, and the issue of the data started coming up. Prior to that, yes, people present to hospitals, people present everywhere, but you couldn't lay your hands on some consolidated data to guide that needs to come up. And since then, we've had many sexual assault referral centers come up. But I'm going to be focusing just quickly on that in Lagos and that in Sokoto, just to compare. So this is the data. If you look on the left, I need to inform that I got permission from the Partnership for Justice, who runs these two centers and who I work with closely, to share some of this data and to present, the information. So on the left, we have the Nana Khadija Center, which is in Sokoto, and on the right, we have the Mirabel Center. This is just showing us the gender affectation. But what is really important that I wanted to bring out here is, if you look at Mirabel Center, most of the survivors have been female. We have more than 97% of them female. But if you look at what happened in Sokoto, we have about 31% of them are male. So that shows that, when we are talking about sexual violence, we shouldn't just focus on women or the girl child. In some areas, boys are also affected and they can't really speak out. Again, looking at the age group of those that have reported at both centers, predominantly what we have is the 11 to 17 age group. Again, this is critical because when you look at the video that came out recently and the whole hula baloo, what we should see is that this is actually an age group of, a high risk age group of people that could be affected by sexual violence, sexual exploitation, or even being misguided in carrying out certain acts. So a lot of focus needs to be on this age group. Of course, we can also see that even younger persons between the age of 0 to 10 years are also affected. So children are particularly vulnerable when you're talking about sexual violence. Again, this slide is just showing us that the majority of those who carry out these acts are known. They are not some criminal or some person that you cannot identify. They are known, and in both centers, what you've seen is that if family members could be involved, but even people that are not family members but are known to them, so it's not something of an unknown perpetrator taking part in this act. Of course, a lot of times we see single perpetrators, though I couldn't really get data on the multiplicity of that perpetrator committing the crime. And then again, this slide is very important just to show us the source of referrals. Most of the referrals that have come in both centers have come in from the police, which of course is important because people always go to the police. But again, we need to probably do more in terms of enlightenment so that you have more of people coming with their self-referrals, as we see here. We have more of that, in Sokoto, and a little bit of that also in Lagos, so that people can actually access care without waiting for the police. And I think a lot of people came in from the police because it was, it involved children. We also need to know that, I didn't really get any data to show schools, referring people, which again, we should do a lot of sensitization to so that people can know how to actually access care. This slide is just showing us that there are so many risk factors, but being young is one of them. Also, there are many myths of rape. I'm not going to go into this because of time, but we need to do a lot to change some of these myths. For example, people feel that when, for example, a woman is raped, it is the woman's fault, maybe based on dressing, maybe based on interaction, and all these are false. People also look at dressing. People look at people, even in court, when we go to court, people try to paint the survivor as lying. And a lot of the data has shown that, nobody really lies about rape. Yes, you could have some cases, but that would be like 99% to 1% from the data that we have. As for risk of children being exploited, we know that they are vulnerable. A lot of times from the children I have interacted with, they don't even know a crime is being committed. They don't even know that something wrong is being done to them. In fact, they are narrating it as if it's something normal. So you're the one that is cringing and wondering what is going on. Of course, there's also the issue of the difference between the chronological and biological age. A lot of our children now are becoming bigger, and so people misinterpret their age. And of course, increasing social media, social economic pressures, and globalization of values is increasing the risk of sexual violence. So as I round up, we need to know that we are all mandatory reporters. A mandatory reporter is somebody that has to report when you come across a suspicious dealing with a child. And even if you are not sure, you can still report. For example, in Lagos, we have the Domestic and Sexual Violence Agency taking anonymous reports, and from there, they will now do the investigation. So that's very important. And I try to learn a psychologist, a teacher, everybody is involved, a religious leader in reporting. So in the challenges, as I round up now, they are patient-related, they are health provider-related, and they are policy. For the patients, of course, the shame and guilt of reporting, I mean, I can just imagine, we've seen the kind of reporting that has come out just this last few days, because the involved parent reported, but I think she reported, probably we could debate it, but maybe through a wrong medium, because people just misinterpreted, and that's based on the cultural factors. And a lot of people have lack of knowledge about the rights and the law. Of course, there's also pressure on family and friends. For the healthcare workers, from my own little time, I've seen that we still need to do more, especially with the survivors, even with the law enforcement agents. They see somebody, they say, oh, you two, why did you dress like this? Why did you go out at night? Why did you talk to that guy? And so many funny questions. So we ask accusing questions, and we bring in all our cultural and religious factors. And of course, we know that us generally don't like going to court. And as for policy, really, some work is coming up on national policy, but really nothing yet. A lot of work is still being done on that. I'm sure the other speakers will speak on that. We had challenges with the DNA. For example, Lagos State had a DNA lab, which was doing a lot of tests, and that was, tying us to the offense, but unfortunately it was destroyed during the NSAS protests. So we hope that that comes on board. Of course, there have been also the issue of the sexual offenders register, which only, to the best of my knowledge, Lagos and Ekiti really are the people that are implementing that. I know a couple of states are trying to do that, but nothing yet. And I think this is my last slide. So there's also the issue of delay in prosecuting cases, adjournment of cases, you go to court. Of course, lack of political will by the politicians, maybe a lot of people too are culpable, so they don't want the law to be on the wrong side. And then we have to have a policy on, of course, including the mental health aspect. So I thank us again for taking time out to listen to this. And I need to acknowledge that I got a lot of my data from the Mirabel and the Nana Khadija Center, and of course from the Domestic and Sexual Violence Response Agency. Once again, thank you so much, and I look forward to further interactions. Thank you.
Thank you, sir, for this wonderful presentation. I'm sure we've all learned new things from your slide. Thank you very much for putting it together. So the next question would be for Dr. Abdul Malik. As a psychiatrist and in your experience, how often do you see survivors of sexual assault? And what can you tell us about the impact of sexual assault on emotional and mental wellness?
Thank you very much, Dr. Ayoguno, and very good to see you again. And thanks a lot, Dr. Shodipo, for laying an excellent background for this. So I'm just going to focus on the presentation and the emotional impact, as well as how we can help survivors. And I will share a few slides just to give us something to look at as we discuss these issues. Please let me know if you can see my slides. Can you see it? Okay, thank you. So this is picture of the University of Ibadan, the first and the best. So I just like putting that there. So when we talk about gender-based violence, sexual assault, it's important for us to appreciate that violence against women, and Dr. Shodipo was very right to mention that in some instances, males are also victims. That's absolutely true. But it's been called the most pervasive, yet the least recognized human rights abuse in the world. And we know that around the world, 1 in every 3 women have been beaten, coerced into sex. This is WHO statistics. Coerced into sex or abused in some other way, most often by someone she knows. And that's a point Dr. Shodipo also stressed, you know, including by her husband or another male family member. And then 1 in every 4 have been abused during pregnancy. So I'm going to illustrate a case scenario to bring home to us the kind of emotional and psychological impact that they often go through. So this Mrs. Lagbaja is anonymous. So that's why I'm using the name. It's not anybody's name. So, but this is a real patient. Of course, identifiers change, the age and other details have been changed to prevent identification for anonymization. So she was a 35-year-old married banker, mother of 2 children, who we saw in our clinic in UCH, presented with crying excessively, not talking to anyone, refusing to eat, going to take a bath every 30 minutes. And then she'll just sit and be staring blankly into space. And she stopped going to work. Remember, she's a banker. And these symptoms, all these problems have been going on for the past 4 weeks before they presented to the hospital. And the husband was getting worried. That's why he brought her to the clinic. And he then mentioned that a week before symptoms started, these symptoms have been going on for 4 weeks. So before that 4 weeks, a week before, armed robbers had gone to their house, robbed them, and then the 3 of them raped her in the presence of her husband. Okay, and the husband was very understanding because, of course, he was there, he saw what happened, and he was very supportive. But when symptoms, because of the secrecy and the societal stigmatization, they informed the police about the robbery and neighbors, but they didn't mention the sexual assault because of the stigmatization and the shame. So, and then he was very supportive and encouraging. But when a few days she was still crying, not eating, not talking, just staring blankly into space, going to take a bath every 30 minutes, he then became, you know, initially he understood and he felt, okay, she will get over it, and was trying to encourage her and be there for her. But when 3 days, 1 week, 2 weeks, 3 weeks, 4 weeks came and went and there was no improvement, he then realized that this was beyond what he could resolve alone. And that's why he brought her to hospital. So of course, it was obvious to us that she was depressed and she was in no state to go home. So we admitted her and then started treating her for depression. And over time, when she wasn't talking to us when we were asking her questions, she was just staring blankly. After some time, she then admitted, when she started communicating, that previously when she was in secondary school as a teenager, she had also been raped by her lesson teacher. And so she had severe depression and she felt dirtied and violated. And that's why she was taking her bath every 30 minutes. She felt her body was the source of her repeated misfortunes and therefore did not want to nourish it again. That's why she stopped eating. She was refusing to eat. Why is she nourishing the body that is attracting this kind of negative assaults, you know, to her? And she also was blaming herself. What did I do wrong? Why am I different from other women? Why am I the only one attracting this kind of, you know, assault? So she was blaming herself. And so she had feelings of guilt. How could she be sure that this will not reoccur again tomorrow or next week or next month? So she had feelings of hopelessness and despair. And perhaps it may be better for her to just sleep and never wake up again so that all these problems will just disappear. And so she had suicidal thoughts. Now, what are the major emotional consequences? Immediately when such sexual assault occurs, there is shock. Did this really happen? Denial, no, it can't be true. Maybe it's a bad dream. I wake up and realize that this didn't really happen. Fear, because they then become very afraid. Who can I trust anymore? So people are looking at me as an object of prey, like a prey, you know. Confusion, anxiety, withdrawal, feelings of guilt. I already mentioned I should blame it. Maybe it's something that is something wrong with me. It's my fault. Distrust of others. Some may have symptoms of post-traumatic stress disorder, and emotional detachment, sleep problems, you know, and so on and so forth. These are common. Some may have very severe depression, like the case of Mrs. Lagbaja I just described, that we had to admit her for several weeks before she eventually made good recovery. Some may feel like attempting suicide. Let me just kill myself. I'm better off dead. I'm of no use, you know. And so some may exhibit personality change. Someone that was very introverted may now become very disinhibited and say, what's the purpose of trying to be modest and being chaste and so on, when people can just come and, you know, rape me without my consent and all of that. Or they turn to alcohol and drugs to help them forget about the pain. Don't forget that pain is not just physical pain. There's also emotional trauma and emotional pain. And sometimes emotional pain can actually be more devastating than physical pain. So when people experience this kind of pain and they don't have an outlet, they want to numb it by taking alcohol, by taking drugs, something that will make them just forget about it. You know, persistent feelings of low self-esteem. So feeling of low self-esteem is also quite very common. And some then develop serious trust relationship. They can't trust another human being again. So you can't come to them if they are not already married and say, oh, I love you, I want to have a relationship with you. They look at you and say, I'm not interested. And that may even persist even to when they eventually get married and so on. Trust becomes something they really, really struggle with. So they have strained relationships with family. Sometimes they blame their family. Oh, if only my parents were there, it's because they left me alone. It's because, so sometimes that damages family relationships, okay? And they may have less emotional support from friends and family and so on and so forth. Why does sexual assault occur? I will be very fast now so that I round up quickly because I don't want to. So one of the major reasons predisposing to sexual assault is what we refer to in psychology as the sexual objectification theory, where you objectify the body of a female. I mean, we know it also happens to male, but most of the time it's female. So you objectify it, and the media is also not helpful. If you look at music videos, if you look at some, you know, online content, you know, a female is glamorized only for her physical sexual appeal, and so on and so forth. And the role of media and music videos is not helpful in this regard. So a woman's body is seen as an object of lust rather than seeing the woman as a human being like me, right, with emotions, with intelligence, to be valued and treated with respect and dignity. So if you then begin to see a female as an object for the gratification of your lust rather than as a human being, then you may then be tempted to think that you can take it by force or by intimidation and so on, just to gratify your lust, okay? And I won't go into too much detail about all of these theories. Dr. Shodipo also mentioned for some individuals, it's about power dynamics and manipulation and them feeling good, boosting their ego and all of that. So, but let's focus on the most important aspect. How do we help someone who has experienced sexual assault? Research shows that the first person that a survivor shares it with, if that person reacts well, it can greatly improve the chances of recovery. But if the person says, your own is finished, this happened to you, you know, the person will feel even worse. But if you just, even if you don't know what to say, just hug the person and, you know, hold their hands, pat them and say, oh, I'm really sorry. I empathize with you. And just, if you don't know what to say, just hold their hands and pat them and be there with them. And if they are crying, just, you know, pat them on the back, give them tissue, just stay with them. Okay, be kind, show empathy, don't be judgmental. Don't say, you know, and all of those sorts of things. And if you don't know what to do, encourage them to seek professional help. But what I really want to encourage all of us to do is to learn what we call psychological first aid. We all have first aid box in our offices, in our hospitals, and so on. If a child has a bruise, you know what to do, right? Wash it under running water, clean it, apply iodine, put a clean bandage or plaster and all of that. So we know how to do that for physical injuries. We should also learn how to give psychological first aid. Everyone can do something. So if someone has gone through any form of trauma, whether it's sexual trauma or any form of trauma, be there for them. Just listen. All you need to do is just listen and be empathetic. Show them that you care, you are there for them, and you want to help them in any way you can to overcome the trauma they've experienced. Let them know that it's not their fault, because they tend to say, it's my fault. If I had not gone for that party, I thought it was my boyfriend. If I had not gone to his house, this wouldn't have happened. So let them know that it's not their fault. Okay, listen and don't be judgmental. Don't say, why did you two go to his house at night? Why were you two wearing shorts? Why did you two go to a party? That's not the time to be judgmental. Please don't be judgmental. Don't be dismissive. But this happened 2 years ago. Why are you still crying now? I mean, because we tend to be dismissive sometimes we think we are encouraging them to move on, but it comes across as being dismissive. So show empathy, be patient in supporting them. Know that healing is a marathon. It's not like malaria that in 2 days, 3 days, you are healed and you are fine. This is the long haul, and you have to be patient and continue encouraging and showing them support. But if symptoms are severe, then please consult a mental health professional, a clinical psychologist, a psychiatrist, in a teaching hospital, federal medical center, neuropsychiatric hospital. See them and let them provide professional help. The Acetal Foundation has a helpline. The helpline is a free telephone consultation. It's one-off, it's just psychological first aid. For anyone going through emotional distress, you call the line or send a message. One of our mental health professionals, someone that is competent and qualified, will call back and speak with you and have a session with you online for free. But it's one-off. We are not doing continuous telephone follow-up and so on, because it's not very effective. But as a one-off, to speak with someone who is an expert, it is very useful. And if we then see that your symptoms are severe, we'll refer you to the nearest mental health facility closest to where you are, anywhere in the country. If you are in Ilorin, we ask you to go to the University of Ilorin Teaching Hospital. You are in Kano, go to Aminu Kano Teaching Hospital. You are in Enugu, go to Neuropsychiatric Hospital in Upper Chime, New Haven. You are in Calabar, go to this place. So wherever you are, we can direct you to the right place to get continuous expert care. But for first intervention, please call our helpline 0902. This is it here, 0902-8080-416. And please follow us on our social media handles. Join our Facebook community. We provide emotional tips. We do trainings on things that will help you improve your emotional well-being. And our message is this: real men don't abuse women. Please stop the violence. Thank you very much.
Thank you very much, sir, for that wonderful and interesting presentation. I believe we all learned a new thing again. And at the end of this webinar, I guess we'd have to write a lot of notes and just make sure we remember this thing. Psychological first aid, when you encounter a victim, a survivor. Yeah, I just learned that, So when you can encounter a survivor, you don't just be dismissive of their emotions. Even if you have nothing to do, just keep quiet and hold their hands instead of making them feel worse than they already feel. Also, I believe Dr. Makinde is compiling a list of resources. And at the end of the presentation, she will tell us more about how Lifestyle Champions International is working towards gathering these resources, more like a one-stop shop for people if you need to access this care. So I'll be talking to Mrs. Karemo Timi now. She's a certified gender and sexual violence instructor. And I would like to know more about the kind of services she provides. And because the past few weeks, we've had, an increase in the number of child molestation and sexual inappropriateness, what kind of knowledge should parents give their children? And where can they get these resources? So basically, she'll be telling us about the kind of services she provides, her experience with the community, like in terms of what kind of knowledge parents should give their children and where they can access these resources. So this is for Mrs. Darren Mortini.
Hello, everyone. Good evening, everyone. Good evening, everyone. I don't know if you can. I don't know if Elizabeth, can you hear me?
It appears the reception is poor, so could you please start over?
Hello.
Yes, this is better now.
Okay, can you hear me? Can you hear me, Elizabeth?
Yes.
Okay. Good evening, everyone. My name is Bridget. I work with a sexual referral center known as WARIF. Also, when it comes to the information parents should have for their children, the first thing I normally tell them is start them early with sex education. Start early with the child. Sex education is very important. A lot of time we hear within our circle where parents don't call the organs in the body the names they are supposed to, penis, PP. You hear. So children at that age need to identify their body. You need to identify with your child and are able to tell a 5 years old, for instance, that you are a girl and you have breasts and you know the body parts, you name them as they are. That child grows up to understand and appreciate her body. And you begin to tell the child the red flag, the no zone areas where nobody should touch at that early age. The child will safeguard him or herself in your absence. Oftentimes, parents leave that responsibility to the school or to somebody else that's maybe a caretaker or, the care you're supposed to have with your child. If you don't connect with your child early, teaching the child what he or she is supposed to identify as body parts that belongs to her, that belongs to him, the child will learn it somewhere else. Be it good or bad, the child will learn it somewhere else. And oftentimes it's from the side, it's from the wrong side. If you don't tell your child, for instance, you have a girl child and you don't tell the child, I love you. I love you. It's coming from mommy, it's coming from daddy. Somebody outside will tell that child. The same way it applies to the body of that child. If you don't teach that child, say you have a boy, and you tell the boy you have a penis. The boy will go out and learn it from somebody else. But if you have taught that child at that early age what sex education is, how to defend him or herself, even in your absence, when an abuser comes and trying to groom that child, the child will be able to open up to mommy or daddy and say, I went somewhere and this person was doing this, because that child has been taught. So early education, sex education particularly, is important for children. A lot of children need to know this, need to understand that their body is their body. They need to understand the concept of, you can't touch me without my permission. If you touch me, I will tell mommy. If you touch me, I will tell daddy. No needs to insist, shout, speak out. It is important to teach the child to speak out. Speak out when somebody is trying to intrude into those red flags, into those areas that you have taught the child nobody should touch. And the child will shout. If you're not there, the child will shout out to the nearest adult that is close by. If we silence the child with names like pee-pee, when you're supposed to say penis, how do you expect that child to say no when the child does not even know what his penis is for? So it's important, it's very important. When I meet parents in forums and I'm talking to them, I tell them the first thing you need to do is to teach your child how to identify who he is, the value and the importance of his or her body, the importance to say no, the importance to open up, the importance to speak out. It doesn't matter if he's a friend in the school, it doesn't matter if he's a neighbor's child. When that barrier is broken or is about to be broken, please teach the child to say, stop, no, I will report you to my mommy, I will report you to my daddy. Have a connection with your child. The more connected you are with your child, the more the child is free and confident to tell you if something is going on wrong. Now, a lot of resources that parents can get, there are books out there they can read on sex education. There are child advocates outside and instructors like myself that they can sit with and get knowledge of how to go about teaching or training their children about their body parts and the ability to say no, the ability to know when there's a red flag. When most times children need to also understand that it is somebody who is close to them that is always a threat. They groom them. You have an uncle who is a pedophile and likes this child. He's not going to come in one day and abuse that child. He's going to groom that child. He's going to shower the child with love, with gifts, and begin to groom the child. And if you are not observant enough, the child becomes a victim and is assaulted. And that's what we're trying to prevent. I tell people recently when the issue came up with the little girl, and I tell people that, look, she's a victim. Somebody groomed her to get to that stage. Let's avoid that grooming cloud around the children. How can we do that? We can do that by teaching them early what sex education is about. We can do that by building confidence between ourselves and our children, that my child can trust me and open up to me. We need to have a listening ear as adults and as parents when our children are actually talking to us. Mommy, when I went to school, my teacher was, immediately here my teacher was, or my teacher did, pay attention to what that child is saying. It might not be an assault, but just pay attention. You are giving that child the confidence to always come to you to be open. Another thing that we should also look at as parents is to say, okay, you have a child that is very active and suddenly the child is withdrawn. What do you do? The child that is very active and is withdrawn and is saying, I don't want to go to school today. I don't feel like going to school today. Try and find out why that child is resisting going to school. Try and find out why that child suddenly is telling you, I don't like that uncle. I don't want to visit that uncle anymore. Something is wrong. Try and find out why that child, don't insist. Oftentimes you hear parents say, you must go to school. Today is school, you must go. And the child is saying, no, I don't feel like. Try and find out why. We should listen more. Adults don't listen. They don't listen to the children. We should listen more to when a child is trying to complain. It's not going to complain like you and I. It's going to come from the angle of a child, an innocent child, trying to reach out to you so that you can hear. But if you don't listen, you will not see, neither will you hear. So we need to learn how to listen to a child and pay a lot of observation, carry a lot of observation when children talk to us. Look at the body language. A child suddenly who is close to an uncle decides to say, I don't want to deal with that uncle. I don't like that uncle. Find out why. Don't put on that parent's cap and insist with your authority as the parent over the child. Come down to the level of the child and understand why. It is in the why, it is in trying to find out the why that will save the child from the next problem that might come up, that has even started, that will stop it. So a little advice here to parents is to listen more. The children are talking this, but we are not listening. We should listen more. We should observe more. And we should start early. Start early to teach them. Sex education is important. Teach them. Don't leave it to the school. If you teach your 5-year-old child how our body is, how to appreciate our body, you have brought that child closer to you. My mommy said this. My mommy said you should not touch me. My mommy said when I'm taking my bath, when it's bath time, that's when I undress, and it's only my mommy that can dress me. When that child grows up to understand that nobody else can undress her, it is difficult for anybody to groom that child because she has a mommy or a daddy to run to say, Daddy, somebody outside wanted to take my bath or wanted to take my clothes off, but it was not time for me to take my bath. I don't understand why. So you are building the confidence level of that child, and you're also drawing your child closer to you, to trust you. Now, care that we can give to people who are raped or who have been assaulted in one form or the other, we really need to appreciate the Lagos State government and the efforts they are doing, really. Lagos State has really been one state that has shown the light to the other parts of the country that it can actually work, that sexual referral centers can actually work, that people can walk in and find help. So for my own organization, we have a sexual referral center where the services, like the other speakers have said, how the services are free. You can walk in, you can call us. We have a 24 hours helpline. You can call. The line is free for you to call any time of the day. The counselors are always at the other side to speak to you. So when you're trying to assess care, a lot of people, the most common problem we have when you talk to survivors, you find out that you don't want to go and talk because it's a family thing. And the stigma attached to it makes a lot of survivors not wanting to talk. So we try to encourage everybody and anybody we meet every day of our life that, look, if you know somebody, speak out. If you are the survivor, speak out. It's only when you speak out that help can come. So for us as an organization, we do forensic tests for our survivors. We work along with the law enforcement agency. We ensure that when survivors come into our facility, they receive the care, the psychosocial care they deserve. We give it to them. The medical forensic is done. And oftentimes, like Dr. Jibril mentioned, a lot of listening has to go into this conversation. You don't have to blame a survivor. You don't have to play the blame game. At that point, that person is looking for help, is looking for comfort, is looking for that voice that is different from every voice she has heard, the voice that will hold her on the hand and say, it's okay, everything is going to be fine. It's just a matter of time, you will get better. So rounding up my talk on this is to summarize everything I've said, parents should listen more. Parents should start sex education at a very early age. Survivors should be encouraged to speak out. Survivors should be encouraged to visit sexual referral centers that are scattered around Lagos, that they can get help from. If you know somebody who is hurting, please don't judge that person. Reach out, tell them there is help them to recover, because that's what they need at that point. Help them to recover. Thank you.
Thank you very much, Ma, for that presentation. I'm sure as parents and community members, we have organizations we belong to where we can spread this message, because one of the aims of this webinar is to break the silence. in whatever position you find yourself as a parent, a school teacher, healthcare professional, it's very important we play our role because it's actually more common than you can imagine. The truth is we don't have all the statistics like Dr. Shodipo said. Many of these things are like, they go unreported. So we are trying to break the silence, and I'm sure we've learned at least one or two things from this webinar. So as we are rounding up, if you have any questions, please send your questions to either myself or Dr. Makinde, so we can ask the panelists at the end. So I'll just ask the panelists one more question, and they'll be talking to us more about accessing care for these survivors. And they'll be telling us like in 1 to 2 minutes each. So I'll start with Dr. Shodipo. So based on your experience, what types of care can be provided to survivors? And how do they access this care? Because we have to take into cognizance that not every state is Lagos State. So what can be done based on everyone's context so that it's like more practical? So what are the types of care that should be provided to survivors? And if they do not have the facilities, what can they do to, coordinate care so they can link them up with the appropriate specialists?
Okay, thank you so much for that question. I think I would, of course, want to go alongside with what Dr. Jubril said. Once somebody has been sexually assaulted, the psychological first aid is critically important because we have different aspects of health that are affected, either the medical aspect in terms of risk of sexually transmitted infections or things like pregnancy. And of course, we have the psychological aspect, which is more long-term. So I think everybody can just learn some form of support. And then secondly, of course, is now the medical part where we want to reduce the risk of having sexually transmitted infections. So as healthcare practitioners, we need to be very conversant with some of our syndromic management of sexually transmitted infections, drugs for prevention of pregnancy, and then of course, things like HIV too can be prevented. But all in all, I think the concept of having a one-stop shop has been something that I think has worked a lot because it's really difficult. I'm just going to end by giving the typical scenario that works in a hospital. Imagine somebody goes to a hospital, has been sexually assaulted, and you're in a very crowded clinic, which is what most of our hospitals are, especially the public, and you're trying to explain there that, sorry, somebody raped me, and on the second pew, somebody's talking about malaria. I'm not sure you'd really get that impact. So, but with more advocacy that is going on, we need government to take this very serious. The last speaker mentioned about what Lagos State is doing. I think a couple of other states are doing that. So with foundations like yours, I think the message will go out there, and the government needs to ensure that this is very something that is taken very importantly. The last thing I'll just mention is that poverty is a problem. We've had people come to our center that don't even have money for transportation. So even if you write medications or write tests, people get discouraged. So it's going to be it's going to be a continuous effort, and everybody just needs to do something to contribute to their quota. Thank you so much.
Thank you very much, sir. So Dr. Abdul Malik, many times when healthcare professionals have their plan of care, especially in the private setting, it's sometimes unusual to include a psychiatrist in the plan of care because many people go to the private facilities, you don't have a psychiatrist on call like a teaching hospital. And a lot of these things sort of break the care coordination. Again, for some people, it's not like the classical sexual assault case. It could be involved a minor and they discovered maybe months or years later, and they are trying to find out what they can do. So as a psychiatrist, what can be done in such situations? Like how can you incorporate the emotional and the mental well-being of survivors into their plan based on the age? Because now we have child survivors and adult survivors, and based on the environment.
Thank you very much. I want to say that I think there's increasing appreciation for the need for multidisciplinary collaboration and for us to work together. We also, however, need to admit that we have a shortage of mental health professionals. And this is not just psychiatrists alone, even clinical psychologists. We don't have adequate numbers, but nonetheless, we need to make use of what is available. And increasingly, we get consults and invitations to co-manage and review. Let's remember, especially for those of us within the health community, that WHO's definition of health is physical, mental, and social well-being. So you can't talk about health if you are neglecting 1/3 of the 3 components of health as defined by WHO, which is the mental aspect. And we do have people who have survived sexual assault, and several years down the line, some of them, it's as in adulthood that they begin to have problems, and because they have unresolved conflicts over the trauma they've experienced in childhood. So we need to appreciate that paying attention to the emotional or mental health needs of such survivors is equally as important as giving them first physical care and checking to be sure they are not pregnant and all of those other physical things you are doing. They are very important, but paying attention to their mental health needs and helping them to manage their emotions and recover properly from the trauma that they've experienced, because it's a very traumatic experience, is very, very important, regardless of the age, whether it's a child, a minor, or an adult. They need to have a sense of healing, a sense of closure. And many times, even as medical doctors, if you are not a mental health professional, many people feel at sea, I really don't know how to handle this. I don't know what to do. Where do I start from? And all of that. So if you are in that type of situation, even if it's a phone call with a mental health professional to say, I have a case like this, I don't know what to do, how should I proceed? That alone is helpful, even if you can't get a psychiatrist or a psychologist to come and review. So please, let's avail ourselves, and we have that opportunity now. Mobile phone, just a phone call away. You can do a WhatsApp video. We can reach out to people, but let's just remember to include it in our management plan so that we don't forget. And once we put it in our plan, we will be able to find someone that will be willing to help us review and discuss with us. Thank you.
Thank you very much, sir, for that information. So the last question will be for Mrs. Tare Motimi. And please, if you have any questions, like I said earlier, please feel free to send them. You can also put them in the chat box. Once we are done with the main speech, I'll try and go through the questions, and Dr. Makinde to chip in our own advice. So, Ma, what are the ways in which healthcare professionals and community members, sometimes it could be neighbors, and because like I said, not everything gets reported. So how can people in the community better support victims, especially in terms of linking them to resources like yours, where they can get some kind of care pending when you link them up to the next group of people that would provide the specialized care they need? Yeah, you're on mute.
Okay, so either the abuser or the survivor, we all come from communities. We live with these people, we see them. So in my organization, we run a program that we go to communities. We deal with the traditional birth attendants, for instance, and tell them that, okay, if you have a case of rape, please refer the person to us. And a lot of awareness has to be done. People need to understand that there is help. People need to really understand that there is help, and they should be taught how to reach out to places where they can get help. Okay, so let's say we have a scenario of a young girl that was raped on a particular street in Lagos, and she doesn't know where to go to. And there are neighbors who actually have an understanding of where they can take her to. At that point, those people who have the knowledge of where to take that girl to, we normally say, when we get calls from survivors, the first question we ask is, are you close to a police station? So that you can go report to the police when something happens. Go to the law enforcement, because right now they have gender desks in specific police stations in Lagos State. I think they're trying to incorporate all the police stations in Lagos State to have a gender desk where issues of assault, rape, and domestic violence can be reported. So from there, the police have our contacts, they can reach out to us. But in the absence of that, you can walk down to us. We can give you our phone numbers, our flyers are everywhere. Beyond that, what next? That's why I'm saying it is important that we should be our neighbors' keepers. We should be, it's very important that communal living, come together and live together in Nigeria is actually eroding away, where I am watching over my neighbor's child, and without my neighbor being afraid that I'm going to do something to that child. We should be our neighbors' keepers. We should be able to say, hey, mister, where are you going? What are you doing? We should be able to attack without fighting. We should be able to protect without judging. So if you live in a community, be your neighbor's keeper. Watch over the other person. And if there's an incident, reach out. Don't be quiet. Speak out. Okay? Help is not far away. Technology has made it so easy that when you just open Google and click on sexual referral centers in Lagos State, you get numbers to call. And I'm sure a lot of us have some kind of data on our phone, an Android phone that can help us, even if we don't have an idea of where we are going. But we know if you just type rape, help, something will direct you if you search for it. So it is important for me. The most important thing I think is still missing is a lot of us don't care about what is going on aside from ourselves. We should come out from our box and help others, be our neighbor's keeper. If something happens, reach out. There are primary health care around. You can go to those places. They can direct you to the next stage. You can go to the police station. They will direct you to the next stage. There is always a place where you speak out. So we need to speak out and be our neighbors' keepers. We need to watch over each other. And that's where we can help each other. Thank you.
Thank you very much, Ma. So I have a question in the chat box. It's actually for Dr. Abdul Malik, but I want Dr. Shodipo to comment. And this is from Mr. Dan Abubakar, and he's asking about the sexual assault case that happened earlier this week about a 14-year-old school girl. Well, he said an elderly male. However, the information available to me suggests the two people involved were minors. And he said it was splashed all over social media as soon as it was reported to the police. So he's asking, do you think it's proper to do it this way? Is this not stigmatizing to the girl child? And even the alleged abuser who has not been declared guilty. However, like I said, the information available suggests two minors. So in 1 minute each, please could Dr. Abdul Malik and Dr. Shodipo comment on cases like this?
Right. Thank you very much. Thank you, Dr. Dan. I think it's important that the media has a very pivotal role to play with respect to reporting of this type of situations. It's not helpful to splash details. We need to consider, take a step back and imagine if this were to be my daughter or my relative, will I want her face and details splashed all over the media like that? There should be protection of privacy, especially of minors, when cases like this occur. There is absolutely no need to put their face and their names and all their details, their address, their parents, the school they attend, and all of that in the media. For it's a poor, journalism, poor lack of professionalism that this happens, so regularly. We also commonly complain about that in suicidal attempts or cases of suicide, where they put all the details and there is absolutely no respect for privacy. And so absolutely that sort of reporting is below par. and shouldn't be encouraged. We should rather discourage it and maybe do trainings for media practitioners on how to report this kind of cases in a way that is professional and still protects the privacy of the individuals involved. And I think he was referencing a case that happened in the north, not the case that happened in Lagos with 2 minors. So this is a separate case. So those are my thoughts. Thank you.
Yeah, and then as a follow-up to that for Dr. Shodipo, we also have another question from, I think, Mrs. Choma, and she's asking about what can be done to educate the society about helping victims that prefer to announce on social media. I know Dr. Abdul Malik addressed part of it, but if Dr. Shodipo could also chip in, especially addressing the case of minors, where people feel that is happening now, like 2 minors, 1 adult and a minor, like the minor involvement part. And I see I think I can see Mr. Olaniyi's hand, so I would ask you to speak once Dr. Shodipo is done. Thank you.
Okay, yes, thank you. So I agree that, one of the most important things about sexual violence is confidentiality. For example, even if you come to any of the sexual assault referral centers, you can't get the name of the survivor. Most of them use even coded numbers. So even if you work at the center, for example, I work at a center, I don't know, I can only know a client is client 1206. I don't know who that person is. So confidentiality is very important. I think that a lot of people that go to social media to cry out probably do so because they don't have information on how they can seek help. So they feel that if they've lost confidence in the system, and they feel that if they were to report a situation that happened, especially for those that happened years ago, imagine somebody saying, I was sexually assaulted 10 years ago, seemingly by a very powerful person. Most of the time, the first reaction from people is, okay, why now? Why didn't you report all along? You're just trying to seek some vainglory, you're looking for funds. But people need to know that, if once they can get the right sort of help, and has been mentioned by Bridget, she mentioned the fact that, even from the internet, you can get the information on the centers, on the sexual assault referral centers. And the reason why I keep emphasizing on this is because they have a network for both the clinical care and even escalating to provide other types of care like welfare and even contacting non-governmental organizations. So I think we need to really key into that, and we need to educate the populace. For example, when we started the Mirabel Center in 2013, I think on average, you'd see probably 10 people per month. It wasn't as if people were not getting sexually assaulted, but there was no information out there. But as the information has spread, as NGOs have come in, as the people have seen that, people even say, okay, if I get there, how am I going to sort out myself? When people got there, we've seen that the number of self-referrals have even increased. Now, one other critical group that I think needs to be trained, and a lot of training has been done, but more still needs to be done. Again, as mentioned by Bridget, she talked about, a lot of the police stations having what we call family support units. So those people have been trained, and when somebody comes, because initially the police at a point were even examining, somebody would come with an allegation and they say, no, let us even check whether it is true. So with a lot of education, because as we've seen from the data, the first set of people that people want to get to once there's such a complaint is, let me get to the police. But sometimes when they get there, they're even discouraged. Oh, you that you're dressing like this, do you think you even have a case? Or you went to his house by 7 p.m. and you are coming here to disturb us, get out. So of course, with a lot of training that has come in, that has also helped to allow people to have confidence in the system. Because once people don't have confidence in the system, what they feel is, let me get the support from the populace by going to social media. Unfortunately, as we have seen from all the cases, it's actually most times not helpful, because a lot of the people too have very structured and difficult mindsets on what culture should even tolerate, and it just worsens the situation, worsens the psychological burden that people like Dr. Jubril are going to have to deal with, and a lot of other problems. So I think that maybe once we get more confidence in the system, people would now know that I can go to social place, there's information out there. But if they don't have that, we're going to be seeing people going to social media, and it doesn't really help the situation.
Thank you, sir. So I can see Mr. Johnson Olani's hand. So, sir, do you have a question? And while we are waiting for him, this question would be for Mrs. Tare Motini, and it's about giving sex education to the male child. One of our participants noticed that the focus is on female children. So what are your thoughts on providing this to the male gender?
Sex education is for everybody, irrespective of the sex, because like when I'm teaching the boys, what I tell them is you're a protector. We are born to protect the female. You are born to protect the female and protect yourself. So for sex education, it is not about whether you're a boy or a girl. It is the value that you are giving that child. It is important that they understand that there's no discrimination. Sex education is open to both sexes, and it's important it is done at that early age. So it's not about a girl child or a boy child. It is for both sexes.
Okay, thank you very much. So I'll be taking the last question now, and this is for, I think, both Dr. Abdul Malik and Dr. Shodipo. It's about psychological first aid. So what kind of psychological first aid can be given to rape survivors who are toddlers, ages 1 to 5?
Well, at that age, they are not able to be very communicative. And so ways by which we assess children that are really that young is through if they're able to draw or write and all of that. So we see the kind of drawing, maybe they draw someone with a monster that is scary, but at that age below 5, it's not likely that they're even going to be able to even draw meaningfully that you can make inferences from. So you just give them support and encouragement and all of you. They are not very verbal at that age in terms of their communication. So it's just to show them love, show them care, show them protection, and show their parents and other people that are familiar, with them, sort of put them in a cocoon where they feel wrapped, protected, and cared for. That's what I can think of readily as being able to do for them at that age. Let them have a sense of safety. And of course, whoever the assaulter may be, more often than not, someone with access, a family member and so on, make sure that that person is removed from the setting, because we've seen cases like that where it's like a cousin living in the same house, like brought from the village to come and live with in the house to go to school or learn a trade, is the perpetrator. And then they will now say, oh, go and lock him up in the police station. And family members will come and beg. So he's now bailed. And then he comes back to the same house. That is an absolute no-no. And what message are you sending to the child? The child is not going to have nightmares, is not going to feel safe in that house. So the least you should do is the perpetrator, if is someone within that environment, if it's not somebody under your household, but a neighbor, you can relocate from that environment if you can't get adequate prosecution, because sometimes we know that the number of successful prosecution of cases is very low, unfortunately. And so if you are not able to do that, you can at least remove yourself, your family, and the child from that environment. All of those little factors go a long way to helping the child feel safe, feel secure, so that they can outlive and overcome the trauma. So, but at that age, really, they are not able to verbally express themselves and communicate in a very meaningful manner. But please, let's just try and ensure that they get a sense of safety, comfort, and protection. Thank you.
Thank you, sir. So Dr. Shodipo, what kind of medical first aid can be given to toddlers who are also survivors? We are rounding up now, and the next few minutes would be done. Thank you very much.
Yes, thank you. So, what we focus on for the toddlers is to basically try to take care of some of the risk of sexually transmitted infections. So depending on the case scenario, depending on the timeline between presentation and when the person, when the child was brought to the hospital. Usually, if it's within the first 72, 96 hours, you would, probably want to do some tests, including if it's possible, a swab, if it's possible without causing any injuries. And then also, of course, we also do a forensic medical examination, try to document the injuries, which is
Well, I think the reception went off. So
things like the hymen still there and things like that. So what we try to do is to give antibiotics, then try to give drugs to prevent HIV, not attempt menarche. Are trying to prevent HIV and trying to prevent other sexually transmitted infections. The other thing I just want to mention is that, please, for those that are in Lagos, the Domestic and Sexual Violence Agency, it's really a key resource. They are doing a lot of work. So even if somebody cannot get to a center, if you get to the DSVA, they can now link, and provide all the support, and forgo all these. Okay, I don't know where the SAC is. I don't know, and I think they are actually located at at a Lausa Secretariat, and it's being run by a very vibrant executive secretary, barrister, who, once you give her a call or once you reach out to the agency, they're going to follow up. Even if it is a suspected case, you want to be a mandatory reporter. Oh, I think something is going on somewhere. If you Google and get their the DSVA phone number and send an anonymous message to them, they would launch their investigation. So we shouldn't be afraid of speaking out, as has been mentioned, all through this discussion. Thank you.
thank you very much, sir. So Dr. Makinde, do you want to recap and just tell us more about what Lifestyle Champions is doing and give a brief closing remarks?
Wow. It's been a great evening. I want to say a very big thank you to all our panelists tonight. I'm sure that every one of us has gained one thing or the other, but it's so clear that the mindset of people out there needs to change. One of the things I've learned tonight is that depending on the different areas of the country where you find yourself, the reports on sexual violence actually vary. And that's why you see that in the north, you have more males, speaking out or being reported as being assaulted. But I think there is so much to take home from this discussion. But at the end of the day, the reason why we have staged this panel is so that people will know that they can access care, after sexual assault. So there's so much in the media, there's so much trending. I know that a lot of meetings have been holding, just to get people to talk about this topic. When we drew up our program last year, we didn't realize that would trend around this time. But because one of our objectives, and let me see if I can share something with us on the screen, because we need to know a bit more about Lifestyle Champions International, what we actually do. And that will help us to understand the reason why we even came up, with this panel in the first place. So let me see if I can share. Okay. Yes. So just to tell us a little bit more about Lifestyle Champions and how do we come in, talking about domestic violence or sexual violence. We're actually a non-governmental, non-for-profit organization that aims to promote wellness by educating and encouraging healthy lifestyles or choices among the Nigerian populace. So this is our overall objective. However, the way in which we do this is to educate people. So we create awareness. We have our websites, we share blog articles, We share on Facebook, on YouTube, and other social media channels, how people can improve their health-related quality of life just by doing some intentional things deliberately, so that at the end of the day, we are able to address the root cause of disease. However, one of the primary objectives that we have is also to support and to empower women to rise above domestic and sexual violence. And that's because emotional and mental well-being is key for you to be a lifestyle champion. I remember the case that Dr. Jibril shared about this woman that was sinking slowly into depression. So how can that woman enjoy her life, even if she had people supporting her? But if those people don't know what to do, you just learn one day, that she committed suicide. And actually on the radio yesterday, someone called in to talk about how her very close friend, her best friend committed suicide, and they thought they were giving her all the support she needed. So it's very important that we are all conscious of what women or men who have been assaulted, what they go through, and helping them to rise above this is creating the pathways for them to access care, whether physical care, emotional care, mental care. What we do at the Mirabel Center, for example, you get that initial, care for whatever physical assault has been, carried out. You get justice and all that, but over the years, it takes time to heal. And I remember sharing a story about what I went through, as a doctor. I was a doctor on duty, in a private hospital many years ago. And I remember that one night, robbers came into the hospital pretending or masquerading to be patients. They brought out guns. They told us to lie down. I was pregnant then, maybe about 5 months pregnant. And in front of me, they raped, two of the staff. It was really heartbreaking. It was something I couldn't forget in a hurry. And I know that some very close people to me, have gone through that. It could have been me. So it wasn't because of what I was wearing. It wasn't because of how I looked. And that's why we also need to stop people from saying it's because this person appeared like this. It's because of a perverseness already in the mind of the abuser. And that's why several years ago, maybe we call it in the ancient times, people will go around with, they are more or less half naked. We can't wear what people were wearing back then, but most of their body was exposed, and you didn't hear about all these assaults, sexual assault and violence then. And that was because of the mindset. But because of the perverseness that is increasing in the society generally, which we need to address, by training the boy child, by training the girl child, by being present as parents, there's so much we can do. So let's not all stay there and put with the blame game and say it's because this person was wearing this. Of course, that doesn't mean that we should not train our children on, how to dress properly, but that is no excuse for anyone. I know people in hijab who were raped. So please, let's spread this important awareness around, and let's let people know that they can get help. When I wrote an article about my experience and I shared it on our blog, there was a lady who wrote back, her responses are still there on the blog. And what I was trying to share that day was about how you can recover, from rape. And one of the things she mentioned, was forgiveness. How do you forgive your abuser? Even though you've gone through all the care, but in there, you feel that, that's apart from the guilt, you feel hurt that why did this person do this to me, especially if you know that person, and it's difficult to forgive. But when you forgive, that also brings healing. It brings relief. It's also part of the process. So there's so much that goes into it. And I can't begin to talk about any of those things because we've had a lot already. So if you want to follow us at Lifestyle Champions International, please go to our website, www.lifestylechamps.com. You can follow us on Facebook at Lifestyle Champs, or on YouTube and Instagram at Lifestyle Champions International. You can engage with us. There are several other things we talk about, healthy choices, what to eat, what to drink. Are you exercising regularly? Are you moving your body? Are you connecting well with loved ones? So all of these are healthy choices which we need to make every day so that we can improve our health-related quality of life. I really want to thank everyone for staying with us tonight. I saw some very esteemed colleagues in the audience. I know we have a mixed crowd today. We have medical professionals, we have allied health professionals, we have other professionals from other walks of life. And even though it's a mixed crowd, I'm sure each and every one of us has taken something away from this panel discussion. You can do something. And one of the things I want to advise us not to do is don't share videos, that depict, children or adults being involved in certain things. Someone was telling me today, it's pornography if you are sharing those kind of videos. So someone will go and say, I watch this video, and you share it and it becomes viral. It's actually wrong. And none of us should contribute to that. Rather, we should, if you know that the video has been shared, do something else that speaks against it and that encourages the abused person to know that we care about them. I can see a lot of messages still coming in. Yes, everyone is, it's a discussion anyway, so it doesn't end here. And I really want to thank, I saw Professor Lukoba from the that's from the Nigerian Medical Association. I saw Dr. Akimu Shutsi as well. Thank you for being here, sir. Quite a number of people. I don't know whether I'll be able to call everyone's names, but I really want to appreciate you for being here. I want to say a special thank you to Dr. Shodi, for my esteemed colleague, as well as Dr. Jibril Abdul Malik, who were in school together way back in UCH. Mrs. Bridget Tarimoni, Tarimotimi, I hope I pronounced that well. Thank you so much for being here, ma'am. Thank you, everyone. So we want to encourage everyone to have a restorative sleep. So we're not going to keep you beyond now. Usually our meetings last between 1 hour and maximum 1 hour, 30 minutes. And we're already on the verge of 9:30. So I think what we can do now, I don't know, Dr. Yoguno, do you have any last minutes?
No, I just think that if we participated in this webinar, we have the moral obligation to actually do something, break the silence, like all the panelists said. And we noticed the disparity in demographics between the northern and southern Nigeria. And like Dr. Abubakar was noting, I think I read some of the comments in the chat box. Wherever you find yourself, just try and do something. If it's linking with people, it might be the teaching hospital or somewhere close to you. Just make sure you are doing something. And in addition to what Dr. Makinde said, it's actually criminal to share child pornography, no matter what it's depicted in the video, it's a crime. And not just in Nigeria, in other developed countries. So let's not forget that. In terms of education, we think we are trying to educate people, but it's very wrong. So thank you very much for joining this webinar. I believe it was recorded and it will be available on the Lifestyle Champions pages if you need to refer it to someone. And I believe she's also trying to compile a list of resources that would be of help to both healthcare professionals and community members, where you can get access to care. And also, I think the FIDA in each state, they are very involved in, if you're interested in prosecution, the FIDA is the female arm of the Nigerian Bar Association, and they are very involved in prosecuting cases like this. So thank you very much for joining us, and have a very wonderful day.
Thank you so much. I want to, last minute, Dr. Dan Abubakar. He's the president of the World Organization of Family Doctors, that's the Wonka Africa region. Thank you for joining us, sir. And so many other people who are here with us tonight. If you are not yet receiving our newsletter and you want to receive it, please quickly drop your email in the chat box before you log out. Thank you so much, everyone. Lifestyle champions, thank you for being here. Have a wonderful night. Thank you so much.